Well, going under the knife is nothing new for women trying to get a perfect body.
Oh, but now more women are having a very controversial plastic surgery done on their most private areas. 19 Action News reporter Dawn Kendrick with the story new tonight.
The V word. If you're female, you have one. Doesn't mean we're comfortable saying it.
Vajayjay. Up the urinary tract.
Vajayjay.
Vajayjay.
Oprah's version of vagina.
This has been Oprah's Vajayjay.
Oprah's Vajayjay.
Mainstream enough to make it into Urban Dictionary. Whatever you want to call it, the quest for the perfect one is on.
So many women will walk into their plastic surgeon's office with a picture of the perfect vagina and say, I want that.
University Hospital's Dr. Cheryl Kingsburg co-authored The Quest for the Perfect Vagina, pointing out vaginas have hit prime time in the quest for an impossible standard of beauty.
With all that's going on with plastic surgery, it was inevitable that even the vagina would become the focus of plastic surgery. Now we have women coming in with Playboy magazines, even Cosmopolitan saying, I think I should look like her, even if that includes her vagina.
Have you seen an increase, Doc, in the number of patients asking for this?
Yes, absolutely.
Dr. Daniel Medalie, a plastic surgeon at Metro Health Medical Center, has been doing labiaplasty, or a tightening of the skin around the vagina, for about 9 years. And it's not always about how it looks.
By far the most common complaint is really a functional issue, which is that, it just doesn't feel right, or it doesn't feel the same way that it did prior to having kids.
Sometimes it's just in the genes.
Some people are born with larger labia than others, the same way some people have bigger noses than others. Actually, one of the functional patients was someone who was a competitive mountain biker, and she just couldn't sit on her mountain bike comfortably.
Dr. Medalie is doing more surgeries to tighten the actual vagina as well.
And in my opinion, it should only be typically used on patients who've had children, trying to get back to sort of what they consider their normal sexual function prior to having children.
And if you saw the drastic difference in the before and after pictures, it really is obvious why some women need vaginal and labial rejuvenation. Here we won't be showing the new and improved Vajayjay. But bear with us as we try to explain. Imagine the concept of vaginal rejuvenation really works like this.
All you're trying to do is repair and put back together again what was there to start with.
Vaginal rejuvenation, the third fastest growing area of plastic surgery.
It's not one of the most common plastic surgeries, but it is growing quickly.
But is a facelift for the vagina going too far for those obsessed with perfection?
We certainly don't have quite as much of a controversy over plastic surgery, say, for breast size.
In fact, labiaplasty is less complicated. It takes about an hour under mild oral sedation and just local anesthesia. And maybe that's why, even if we can't bring ourselves to say it, Vajayjay certainly isn't stopping some from fixing it. I'm Dawn Kendrick, 19 Action News.